Guys, this is Jennifer from the Morris Clan. Sorry, it's really dark. It is almost 6 a.m. Friday, June 5th. Sorry. Trying to pull it together here. About 5 a.m. this morning, my daughter had a breathing episode where she got down in like the 15% in oxygen. And it took her a dose of oxy and 2 doses of morphine, plus her oxygen being already at 100%. In a room full of nurses and a nurse practitioner and a doctor. And they finally got her back up. They did a chest x-ray and it looks fine. She's supposed to be having cast surgery on Monday. That may be getting moved up today. So, he also ordered for an echo to get done. He just wants to make sure that her surgery of the anatomy of her heart is working correctly like it's supposed to, because it happened just out of the blue. She had been dipping down prior in the 50s and 60s, but they were able with pain management to get her back up. So right now she's currently studying between 70 and 75, which is fine. So I just wanted to give that update. She was doing so good too. Yesterday morning she got a PICC line put in because she tore out her heart line and her one IV in her other hand. So they went ahead and placed the PICC. And after they placed the PICC, they took all her tubing out. So she didn't have her drainage tube anymore. All the wires and stuff from her surgery and her heart drainage tube was all taken out yesterday, and they started her feeds back up yesterday, and she was doing so good, and she was so much, you could just tell she was happier and felt better. The only thing that really, agitated her was her nasal cannula. She's really agitated with it. But we'll see, and I'll update you guys when I can. Thanks. Hi guys, this is Jennifer from the Morris Clan. I'm just doing an update. Sorry about the lighting, but the lights are off, and I've got my laptop because I'm doing some work. But anyway, we are day 10. Well, at the end of day 10, since Kennedy's hemi Fontan, also known as Glenn, open heart surgery for hypoplastic left heart syndrome. She's doing okay. Her lung is now open, which we found that out this morning. She did have fluid still in the lungs, so they left the tube in. We were hoping to get it out today, but they left it in. So she's been on pain management and sedation all day, along with no feeds. They're hoping to start feeds back up tomorrow. They're also, at least I hope they're hoping, I'm hoping that tomorrow that her x-ray looks amazing and the fluid's almost gone by her RT, respiratory therapist. She sounds clear. She said there's a little bit of crackling, she said, but between now and then, between them being able to suction, and she's also on Lasix to help herself get fluid off, that hopefully we can get somewhere. and she can get extubated tomorrow and put on the high flow. I hate seeing my daughter on a breathing tube. Yesterday, seeing her on a breathing tube just brought back so many memories from her normal surgery that I honestly don't know how I didn't break down yesterday. I kept myself there. There was multiple times I started to tear up, but I held it back because you know what? Not that crying makes you weak, but in that moment, my daughter didn't need me crying. She needed me to be there listening to the doctors and what are the next steps. And she can't speak for herself, so I need to be the one listening to what they have to say. And I also need to be giving my opinion on my daughter's care, and I know her better than the doctors. So for me, it was just holding it back and giving everything I had in that moment to just be there for her and give my 100%. Now, after everything was done, we got settled down. This mama took a shower and I bawled my eyes out. I just needed to. It was something I needed to do. She was fine. She was doing really well. So it was good. Today she's done really great. She was on 100% oxygen on the ventilator. She's now down to 75%, which doesn't sound like a lot, but it's a big stride because they didn't even think she could get down any on the oxygen, and she did. So I'm very happy, and she's statting between 78 and 83. So if she keeps statin high, the nurse will take it down another 5, and if she's still doing well, another 5, and they'll just keep going. So that's the plan, was for her just to pee off all her extra fluid and see what tomorrow brings. Did I think that we'd be here on day 10? No. I didn't think we'd run in near the issues that we did, but you take it as you can and you move on. I've gotten to the point where I just take it day by day. So I hope you all have an amazing Saturday, and I will see you all in my next video. Bye. Hi guys, this is Jennifer for the Morris Clan. Yes, I am in my car, and I have you guys set up. So if I'm not looking at the camera, it's because I'm focusing. So we are on, oh my god, what is today? Monday, June 8th. I've lost track of how many post-days surgery. She had surgery on May 28th. So I think we're on like day 12. I may be wrong. But anyway, thought I'd give an update because I haven't updated since I think day 9 or day 10. I'm not 100% sure. Yesterday was rough. As you all know, she is on a breathing machine after her calf surgery on Friday. They tried to wean her off of it Saturday night, I want to say, and they found out that she had developed fluid on her lungs again. And then Sunday came around and they decided that they, she was keeping her oxygen in the high 60s, low 70s, still not ideal where they want them. So they decided that, she does have fluid on the lungs and everything, and they were going to place a chest tube for drainage on the right side, which she had previously. So this would be the second one, this surgery, same thing that she's had in that side. I actually ended up coming home yesterday. I needed a break. Mentally, physically, I needed a night's sleep. I felt like I was starting to fall apart. I thought she was in a good place, being sedated and on a breathing, on the ventilator, and she was doing fine. I knew that they were planning on putting the chest tube in, which again, she's had, she had one during her Norwood surgery, and she's had one already prior to, this surgery, so I wasn't too concerned, because I'm not even allowed in the room while they're doing that procedure anyway. So I went home. I have the number, and I called about 2.5 hours later at 12:30, and I got an update from the nurse, and the nurse had told me that she had developed a fever of 103.2 about 30 minutes after I had left. So they started her on 2 antibiotics. They did a urine, a respiratory, and a blood culture. Then they had not done the chest tube placement yet. So I got a call about 3:30, between 3:30 and 4. I got a call from the doctor that was working, that placed the chest tube. And if you guys can't tell, my face is still really red. My face is puffy. We did nothing but cry and pray yesterday. Our daughter had declined quickly. She had dropped in the 30s and 40s, and she was not coming back up. She was on the ventilator at 100%. They had placed the chest tube, and it did not make an improvement. So I had to give consent over the phone for them to go ahead and place a tube on the left side. Now, this is the first time this side of her chest has had a chest tube. So they did that, and she basically talked to us, saying, if she stays in the 30s and 40s% in oxygen, that her brain was slowly dying, and so was her organs. So if she kept staying there and this second chest tube did not work, where she could at least stay in the high 50s, low 60s, they would accept, just to make sure that her body was getting the oxygen that it needed. But if she could not, we would have to decide whether we would want to put her on ECMO, which ECMO is like an artificial lung. It bypasses the lungs, and it's also very dangerous to take them on and to take them off of ECMO. So that would be a last resort to do, because it could cause bleeds, it could cause strokes, it could cause heart attacks. It's not great. It can help, as she put it, was if we decided to go with ECMO, if she was able to get on it, it would give them time to figure out why her lungs were failing or in failure. And the only other choice that we had besides ECMO was, maybe to let her go, let her pass, and let her go peacefully and comfortably, or ECMO. Those are basically the two decisions that our doctor had given us, because she could not get her stats back up. And that was, like I said, between 3:30 and 4. I lost my shit, guys. No one should ever be told that they have to make that kind of decision for their child, let alone your baby. And she has gone through so much already. And my husband and I didn't know. We didn't know what to do with that information. And, and they, even despite all this information, they still would not allow both of us to be down there with her. it was still only one parent. So we cried. I got my second call around 6:30 that evening to talk about how her second tubing was placed and how she was doing. She had gotten into the low 60s, which, you know, they accepted. It felt like so much relief that she was, this is like 6:30. She was starting around 62% oxygen, still at 100% on the ventilator. It was, doing most of the work for her. But you know what? It felt like, okay, she's starting to show something. And, but she didn't have high hopes for her. She wanted to make sure that my husband and I were thinking the next step. What do we go from here if she continues to decline or does not get better? My husband and I decided that we weren't going to talk about it. We were to the point, we're not going to talk about it. We're going to give her the night. We're going to give her time to let this work. We're going to give her time. And I called every 2 hours, guys. Every 2 hours. I called around 8:30 to check in on her. She was starting 70. I called at 10 o'clock before I went to bed. She was down at 75. I went to sleep finally around 1. And then I called again at 3. She was starting 76. I called at 6:15 before shift change, and she was starting 78. I called at 8:30 this morning. She was starting 81. She was doing so good that they have started weaning her ventilator. She's at 70%, and they have took down her peeps. If you've never had a ventilator, peeps are like breaths that the machine gives you. They have lowered hers to they are doing 2 peeps an hour as long as she is tolerating it and staying where she needs to be. So far, guys, she's tolerating it. She's tolerating it. She's tolerating it, and I just feel in my heart like she's going to be okay. And I'm not going to lose my child like I thought I was going to yesterday. She's made such an improvement. They don't know. They don't know what. It just happened, and she's doing it, and I couldn't be happier. Oh. And they also found out that her infection, she has a UTI. She has a urinary tract infection, so they are also treating that as well. She has gotten off 3 medications. They are lowering her blood pressure medicine to try to get her off that today. Their goal is for tomorrow to be taking the tube out. If you guys have not been through this, when your baby is on a breathing tube, they're so sedated. I haven't seen my baby's personality since Thursday, early morning. About 3 o'clock was the last time I saw my baby's personality. So last time I got to see her eyes open and smile at me. And here we are Monday. And my baby's still sedated because she still has this tube in. It has killed me. I needed a break. And I knew with her being on the breathing tube, I honestly thought yesterday was a safe day for me to go. And yesterday was it was like she just dropped, and we don't know why. But I'm on my way back now, and I will probably not be leaving again. But yeah, guys, that is the update I have as of right now for day 12. Please keep praying for her. And like I said, I made a 1-week post-surgery video, and it's just a video with a bunch of mini updates in it, what she went through for the first week. And I will be doing a week 2. So in 2 more days that should be up, because it'll be exactly 2 weeks since her hemi Fontan chest blend surgery. So this will be in that video. Like I said, I'm trying to keep you guys updated as much as I can. Yesterday I couldn't pick up my phone. There was just no way. I was too lost and heartbroken, and it's just something I never wanted to hear. But she's doing better, guys. She's doing better, and I thank God for that, and the doctors, and her. She's so strong, and she's got so many people that love her and praying for her and just want her home. So that's what we're going to do. We're going to take this day by day. So I will see you guys all in my next video. Bye. Hey guys, this is Jennifer from the Morris Clan. Today's this day 13. Past the hemi Fontan, also known as the bone surgery for hypoplastic left heart syndrome. It's Tuesday, June 9th. She's doing great, guys. Tube was taken out this morning. She's on a high flow nasal cannula at, I think, 45% oxygen, and she will be off the nitric by midnight tonight. She's off all pain medication. The only thing that she is left with is IV fluids, which should be off by tomorrow. TPN, which is a nutrition that goes in an IV for nutrients. She's got her feed started back up, so they will be stopping that tonight. And then she's got one heart medication, which they will wean tomorrow, because they are putting her back on her one that she's always been on. So she's doing good, guys. She's been staying around 80% in her oxygen. Blood pressure's been good. Her heart rate's been good. She got both chest tubes taken out. I don't think it was by choice. The left side was basically falling out and was barely in there. So they went ahead and pulled both. So she doesn't have any of the chest tubes anymore. And if she keeps going, she may move down to a regular nasal cannula tomorrow. We'll see how low she can get in her oxygen. So, and also the flow. Because right now I think the flow's set to like a 10, which is pretty high, and she's getting pretty irritated with it. But she's doing really good, guys. First time I've seen her personality since Thursday. Actually Wednesday, because Thursday is when they started giving her sedation to be comfortable. So yeah, so it's a good update. So yeah, day 12. Granted, we're still on the intensive care unit. But hopefully, if she's able to get off this high flow in a few days and off these drips, we may move to step down, guys. And step downs, you should only be there a couple days. So, we'll see. We'll see. But keep her in your prayers, and I'll see y'all in my next video. Bye. Hi guys, this is Jennifer from the Morris clan. I am giving an update. Sorry, I'm sitting outside. I am at home. My husband is down with Kennedy. He has not seen her since after surgery, and even that, he only got to see her for like an hour before he had to leave because of the whole COVID-19. So he went down this morning and he is staying the day, and I don't think he plans on coming home until like midnight. And he's gonna sleep, and then I'm gonna leave tomorrow morning and probably just stay down there with her until she comes home. So we'll just have to play it by ear. The reason I'm not there was I was there last night until about 11:30, and probably about 8 o'clock last night my back was pinching. I don't know why. I think it's probably due to sleeping in a chair sorry, that was a big gush of wind. For almost 2 weeks, you know. I think that's just really messed with my back. And I couldn't get comfortable. I tried laying on my sides, I tried laying on my back, and I was just pinching. And it was getting to the point like I couldn't even walk without pain like shooting down my legs. So I called my husband. I had the whole mom guilt. I hated leaving her, but I just felt like I was in so much pain and I couldn't really help her, and she was really tired anyway, so I really wasn't concerned. So I ended up coming home last night and climbing into bed and just passing out. That was probably the best sleep that I have gotten since before her surgery. And I think that was just due to lack of sleep, the lack of quality of sleep that I've been getting. But anyway, let's move on to her update. Again, guys, I apologize for the wind and the cars and trucks and stuff that you hear in the background. She is doing amazing, guys. Doing amazing. Tomorrow will be 2 weeks since her open heart surgery. They are weaning her from her high flow nasal cannula. They also stopped all IV drips. They did increase her feeds. She is also on her home medications. All of them? Yeah, no, just 2 of them. She was on 3 before surgery, but she's now on 2 because she no longer needs the 3rd one. So they put her back on the 2, and technically she shouldn't need the other one, but the way that her anatomy is, she's just going to need it, and she'll probably need it maybe the rest of her life, or at least until the 3rd surgery, unless something changes between now and then. But she's on 2 of her own medications. She's off the nitric. She is at, I think my husband said like she was at like 50% oxygen. I'm not 100% sure. But she is coming down on the oxygen as well. They are weaning her off the high flow nasal to get her onto a regular nasal cannula. His goal is to have her on there either by tonight or first thing tomorrow morning. And then he wants to observe her for 24 hours on the regular nasal cannula. And he will then move her to step down, guys, on Friday. If you're not familiar, at our hospital, which is Riley's Children's Hospital, they have a critical unit side, which is what she's been on. She's been on that side ever since after her surgery. Then once they've, don't think she's a critical, that she's, something's gonna happen or anything. Once they're comfortable with it and they think that she's in a good place, they send them to what's called a step down unit. And guys, we were told when she stepped down, all they really make sure is that she's eating, and she's eating well. And you know what? I'm not concerned about feeds because I've had this girl, you know, home for almost 6 months. We've never had an ER visit. She's never been sick. I've handled her feeds. So I have no problem adjusting her feeds at home. And I'm pretty sure the nurses aren't going to care if she's not perfect. But they do look at her feeds and see how well she's eating and to make sure she's not throwing up a whole lot. And they also have to make sure that she's being regular with peeing and pooping, that she doesn't get constipated, which she's never been constipated in her life until this surgery. She has been constipated once, and it took forever for her to poop. It took her 3 days to finally poop. So we'll see. She hasn't pooped since the 5th, so I guess we'll just wait and see. But I have a feeling that's probably going to be her biggest thing. I'm hoping it's not after the morphine and all that's gone now, because that can cause constipation. So pain management causes constipation. So let's get her off the pain medication. So she has not had any since last night, and that was one bolus of a morphine, just because she was really restless and everything else. And they just make sure that she's okay and that she doesn't have any breathing issues. So it is like a sigh of relief that step down was mentioned. I am so happy how we gone from Sunday when we got the call that we may have to make a decision whether to place our daughter on ECMO or let her go and pass peacefully, to we are talking about step down. It's amazing, guys. It's amazing the turnaround that she has done. It's a relief. We are so ready to have her home. We miss having her home. We hate driving an hour and a half, depending on traffic, to see her. And it's just, we're ready for our normal to be back. Our life to be back to normal, guys. It's just, we're ready to put this behind us and just know how blessed we are to have her in our life. And it's just taught my husband and I to never take any day for granted and just spend every moment that we can. You know, it's really made us look at life differently since that very hard phone call. So, but she's doing good, guys. She's doing good. My husband did call me, and I was looking at her, and next thing I know, he set the phone down, and I'm like, "What are you doing?" And I heard her crying. She had thrown up. They took the tube out yesterday, and we noticed that she sounds good. Her oxygen, saturations were good. It's just, she sounded like mucusy, like she just needed to cough something up. And every time she coughs, she's in pain. I mean, I can only imagine having open heart surgery and trying to cough. I'm sure it hurts, and for this to be, she's gonna be 8 months old tomorrow, guys. But for this almost 8-month-old baby, I mean, I could only imagine the pain. So she does not want to cough because of the pain that it causes. So what she's been doing is swallowing that mucus when it wants to come up, and she finally threw it up. Her stomach had just had it, and she threw up a whole bunch of mucus, my husband said, and some formula was in it too, but he said about 80% of it was mucus. But since she's thrown up that mucus, she's statting so much better. I was kind of concerned for a while because she had dropped where she was staying between 70 and 73. She would sometimes get to 75, but then she'd come back down. So I was kind of concerned that, with all the other issues that we ran into, that maybe something had happened or something was going to happen. And my husband said, since she's thrown up, sorry, there's a semi going by. My husband said, since she has thrown up, that She is statting about 85 now, and she's been staying about 85, which is amazing. I mean, we couldn't be happier with that number. So we're really happy, guys. So it's a good day, good update. I will be posting a video tomorrow that will have week 2 videos in it, since I already posted week 1, and there will be another video because she's in there. She's gonna be in there past 2 weeks, so I will make another video that will have the rest of her videos. Hopefully she's not in step down for very long, but if there happens to be a week 3, there's a week 3. If there's not, there's not, and only a couple days worth. So we'll just see. I will keep you guys posted, and I'll see you guys in my next video. Bye.